G'day to everyone here in 1 William Street. Happy New Year to you, and Happy New Year to everyone who might be watching this broadcast, including all of our Facebook friends. Today, Dr Gerard, the Chief Health Officer, and I will give an update about COVID-19, and then Deputy Commissioner Shane Shileppi will do an update on the weather event impacting on Queensland. So we'll let Dr Gerard and Deputy Commissioner Shileppi talk, and then we'll take questions after that, if that's okay. Today, Queensland is reporting 3,587 new cases of COVID-19. The total number of active cases in Queensland now is 16,688. That new total figure is on the new reporting period, which runs to 7 p.m. in the evening. So that reporting period runs for the 24 hours, 7 p.m. on the 31st of December through to 7 p.m. on the 1st of January. There are currently 5 COVID patients in hospital in Queensland receiving intensive care. So there are 5 patients in intensive care units in Queensland. None of those patients are ventilated, and I'll let Dr Gerard say a little bit more about that. So that tells us as we enter a new year, we are entering a new battle against COVID-19. For 2 years, our health system and the hard work of Queenslanders has led to a world-leading defence against this insidious disease. But now we face the challenge of the virus as it continues to make its way through and across Queensland. And so that means to protect everything that we've been able to deliver as Queenslanders, a world-leading health response, and one of the leading economic responses in the country, we need to continue to do what has got us this far. And there are 3 things we're calling on Queenslanders to do today. The first is, of course, to get vaccinated. Whether it is your first shot, your second shot, or your booster shot, it is never too late to get vaccinated. The second thing, of course, we're asking Queenslanders to do is to wear your mask, with the new mask direction coming into play from 1 a.m. this morning. That, of course, will be a significant defence mechanism that we can all be part of to stop the spread of the virus. And if we can slow the spread of the virus, that'll help keep Queenslanders protected, particularly Queenslanders working in our health system, whether it be the public or private health system, so they can get on with their job. The third thing we're asking Queenslanders to do is, where possible, work from home. We know that's an important mechanism as well to slow the spread of the virus across Queensland. And if we can slow the spread of the virus, that takes the pressure off our health system in particular. So Queenslanders led the world when it came to our response to COVID-19, but to maintain everything that we have achieved so far, we have to stay the course. We have to continue to adopt those practices that have kept us safe and will keep us safe in the future. So I might leave it there and ask Dr Gerard to say a few words, and then Deputy Commissioner Shileppi.
So as I mentioned yesterday, we have a new cut-off time for our case numbers. So today's case numbers are for the 24-hour period from 7 p.m. on the 31st of December until 7 p.m. Last night. We have 3,587 new cases to report. This number is probably a little bit smaller, in fact, than we had expected, and it probably relates to testing occurring over the holiday period. So it won't be a surprise at all if in the next couple of days we see a significant increase in cases as more samples are tested and more people come forward. So that won't be a surprise in the next few days if we see a significant rise in cases. That brings Queensland's total to 19,707, and we have 16,688 cases currently active. There are now 5 people being cared for in our intensive care units, but none of those patients are on ventilators, none of them are on life support. Clearly, the disease we are seeing now is of a severity that is significantly less than was seen prior to vaccination worldwide, overseas and in Australia. With 16,688 active cases and only 5 people not on life support in our intensive care units. That number is quite low indeed. So this is a vastly different disease that we're seeing. It's the disease severity to what was seen last year and prior to vaccination. The issue we are facing, though, of course, is that with the degree of contagiousness of this virus, we're going to be seeing very large numbers of cases. Even though the severity is clearly going to be less, we are going to see very large numbers of cases, and a small proportion of a very large number is still a large number. In terms of the people in intensive care, there are 2 women who are pregnant. One is vaccinated and the other is not. This reminds us that it is critical that pregnant women or women who are planning to get pregnant get vaccinated, because the virus is not good for the pregnant mother nor for the unborn child. Many people aren't aware that in pregnancy your level of immunity is slightly suppressed. The theory is that it's to prevent the mother's body from rejecting the baby as a foreign invader. So pregnancy is very slightly lowers your level of immunity in women, pregnant women. This means that pregnant women are more susceptible to a number of different infections, including COVID-19. That is why it is so critical that pregnant women get vaccinated. So there were 33,990 COVID-19 tests conducted yesterday. There are 165 cases in hospital, with 112 requiring treatment for COVID-19. So those numbers are up as well. So as I said before, we're going to be seeing, even though the severity is less, the numbers of people getting infected will be substantial. And that is why these 2 key critical interventions are there to try and slow the spread of the virus. One, to reduce the immediate burden on our hospitals, and also to allow people to receive their 3rd dose of vaccine. And those 2 key measures are to wear masks indoors whenever possible, and also to encourage everyone to work from home where that is possible in your work environment, to minimise contact between individuals. So there were the state vaccination clinics administered 445 doses of vaccine, and the Commonwealth did not actually release any updated vaccine coverage data yesterday. So as of the 30th of December, vaccine coverage was 90.67% of the 16 plus population having at least 1 dose, and 86.60% of the 16 plus population having at least 2 doses. Thank you very much. I'll now hand over to the Deputy Commissioner.
Good morning. I'll just give a weather update for Queensland. So we currently have Tropical Cyclone Seth, Category 1 cyclone, sitting approximately 630 kilometres east of Harvey Bay. This cyclone is tracking south at the moment and is expected to slow down and turn to the southwest Sunday afternoon and head towards the coast. We expect on Monday that the cyclone will lose its severity to a subtropical cyclone strength, a high low. As always, tropical cyclones are unpredictable, and we're monitoring these cyclones very closely, this cyclone. What we're expecting to see is some very high tides on the coast, in our low-lying areas, potentially some flooding as a result of those high tides, and some severe weather action on the coast with respect to waves and damaging surf. So it's really important that anyone going to the coast today and over the next couple of days to be very mindful that there will be significant surf on the coast, some damaging waves, and some very high tides which will cause rips along the coast and some local flooding. As always, our disaster management system stands ready to support Queenslanders should that cyclone take an unexpected turn. Our local councils, our local disaster management groups are monitoring the process of the progress of the cyclone, and if anyone in those low-lying areas needs sandbagging or assistance, we'd ask you to go to your local government website and you will find the information necessary there. So as always, we will see some low-level flooding in areas of Queensland as the cyclone turns towards the coast. So I would just implore on anyone, please, don't drive into flood water. We saw some really unnecessary deaths last year as a result of that, and we'd like to start the new year in a very responsible and healthy way. Thank you.
Dr. Gerard? Oh, sorry, Dr. Gerard, if that's okay. A number of pregnant women have been hesitant to get the vaccine because early on in the piece they were being advised to wait, then the advice changed that they should be prioritised. What's your message to those women?
I'm sorry, could you please repeat the question again?
So early on in the pandemic, pregnant women were told to wait to get the vaccine, then that advice changed and they were prioritised. So a lot of women have been left, I guess, hesitant to get the vaccine, and in some communities there's fear about it causing miscarriages. What's your...
There is now clear evidence that vaccination during pregnancy and when you are attempting to get pregnant is very safe. The vaccines have been given to hundreds of thousands or millions of women around the world with no demonstrated adverse events. So it is clearly, there's clear evidence that it is safe to get these vaccines. There is a very good chance that pregnant women in the coming weeks will be exposed to the virus in Queensland, a very high chance that that will happen. And we know that the virus is a significant risk both to the mother and to the unborn child.
How many cases does the Sherbrooke outbreak stand at now, do we know?
See if I have those. So yesterday evening, we had 38 cases linked to that cluster. So grateful to the community to be responding as they have been. So 38 is the number I have here.
Has there been any extra resources allocated to deal with that?
Oh yes, there's both testing and vaccination resources.
And can you comment on Palm Island? Apparently there's been some cases over there and some issues with the local supermarket.
I'm not aware of that, I'm sorry. Palm Island, I'm not aware of the issue there.
Given the number of cases that are starting to surge in remote communities, are you confident that the state's medical retrieval services will be able to cope with the added pressure?
As this pandemic grows, there will be pressure on all services. So, we will provide care for anyone with COVID-19 in Queensland. That is our clear plan. We have been planning this for a long time. There will be pressure on services, but we will provide care for anyone who needs it in our healthcare system.
And has anybody who's caught the virus in remote communities been taken to hospital yet or intensive care?
I'm aware of one from Sherbrooke who was taken to Toowoomba Hospital for isolation reasons. I don't specifically know of others, but I don't specifically know of others.
Is the pathology workforce coping? We've spoken to people who are still waiting for their results of being tested on Tuesday, and they're unsure if they're positive or not.
There certainly has been very heavy demand on pathology services, and they are upgrading as every day as we go by. Yes, there's been increased demand on services, and but they are at this stage, compared with other states, we are doing well.
How long do you think it's going to take for Queensland to hit that 90% double dose vaccination rate?
Again, I don't have a specific date for that. As we approach that date, we will get a better idea. I did see some commentary in the media this morning from some commentators suggesting that we would not reach the 90% target. That would require tens of thousands of people who've received the first dose to decide not to receive the second dose. So I'm not sure that I understand what the basis of that belief is. I have asked this morning for our own vaccination statisticians and epidemiologists to look at that again, just to see, look at that comment, but I don't know what the basis of that commentary was that we might not reach 90%, because I think it was, when I last looked, we were at about 90.6 or 9.7% first dose. So for us not to achieve 90% second dose, that would require tens of thousands of people who've received their first dose to decide not to receive it. So I don't know why what the basis of those comments were.
The state's roadmap says that at 90%, if you're not fully vaccinated, you have to meet the relevant requirements for entry and be required to undertake a period of quarantine. What are those relevant requirements for entry at 90%?
Entry from overseas or?
From interstate and overseas. And what's the quarantine period they'll have to undertake?
I can't answer that question. I'll have to review it. I'm sorry. I can't. I don't want to mislead you with the wrong answer.
Does the Treasurer know the answer to that question? It's the government's roadmap. Do you know what those requirements are?
No, I don't want to mislead, give you wrong information that would then have to retract. If you can just leave that with us with that specific question, I'll get back to you.
And previously, the government said that at 90%, the roadblocks along the border and the police presence would be removed. Is that still the plan?
At 90%, the roadblocks would be removed. I believe so. Again, I'm sorry. I do need to. I don't want to make a wrong statement and then mislead you. I'm sorry.
The contact tracing sites have been taken down from the Queensland Health website. Do you think that will have an impact on people choosing to check in?
Well, I hope they don't. Because there are three reasons why the check-in app, we maintain the check-in app. One, it's a good way of, for those facilities that require the vaccine passport, it's a very good way to identify you for the vaccine passport. Two, it's a good way of monitoring where you have been if there are major outbreaks in particular areas. And three, if there is a major outbreak in particular facilities, then public health then can pursue you more easily. So at this stage, we are maintaining the check-in app, and we want people to continue to check in at this stage.
Do you think that people will, that down the track, the state government might review that and get rid of the
check-in app? We're reviewing everything all the time. So I don't want, but at this stage, we don't want to stop using it. We certainly don't want to stop using it and then have to reintroduce it again. That would be the last thing we would want to do. So we want to maintain it for the time being.
How often are health officials using that, the app to actually contact people within that exposure?
At this stage, to a relatively limited extent, except where there are major outbreaks. So they're not doing it in a routine way as they were before, if there are outbreaks. So I can't give you specific numbers.
New South Wales is allowing health worker close contacts to work in exceptional circumstances.
Yep.
Is that happening in Queensland yet, or are you considering it?
No, it's not happening in Queensland yet, but we cannot rule out anything in the future.
And you flagged the other day about changes to quarantine requirements for close contacts in a health setting. What are those?
Sorry, say again, repeat again.
So the other day you flagged that there'd be changes for the close contact definition in hospitals. What are those?
It's a complex matrix. It's about to be issued in the next 24 hours, but it's a complex matrix. There's not a simple answer to that. It involves how much time someone has been with the patient, whether both of them were wearing a mask at the time, what the nature of the activity was. So it's a complex matrix. It's not like a simple one-sentence answer to that.
Do you have the figure on how many health workers have contracted COVID now and how many are in quarantine?
I do. So in terms of hospital staff, so around 330 hospital and health service employees have been confirmed as having COVID-19, and just over 724 hospital health service staff are in quarantine because of being in close contact.
Are there any plans?
Very long testing lines throughout Brisbane this morning. Some people say they've returned positive on a rapid test and then have been turned away from the PCR testing. What's your advice to those people?
I haven't heard that specifically. This is people who have had a positive rapid test and they're being turned away. Right. I guess the obvious thing to do if you've had a positive rapid test would be to isolate and then get a PCR test at a future time. That would be the obvious advice.
They're saying that they keep getting turned away because of the length of those lines from people trying to get those PCR tests.
Well, we know that false positive results with the rapid test are relatively uncommon. It's false negatives that are more common. So if you have a positive rapid test, particularly if you have symptoms, one would assume of its accuracy. So I would certainly be treating myself as if I was positive.
Are there any plans to cancel elective surgery at this stage, like South Australia has done as their cases run?
There is some cancellation of elective surgery already I'm aware of in the Brisbane region.
Is that due to the infected staff or more just not having the numbers?
Some of it is due to affected staff, and some of it is due to preparation for the expected increased number. So there is some reduction in elective surgery, mostly at this stage because of staff.
The Category 3s were already cancelled, I understand, to the end of January. Does it now impact on Category 2 patients?
So there's no cancellation. I believe it is affecting some Category 2 patients. I believe so. I don't want to mislead you, but I believe so.
And what work is the state government doing to partner with the private hospitals to ensure that there's still capacity and surgeries can continue?
So this is in terms of using private hospitals as a resource. There's active working. The government is actively working with private hospitals to use them as our resource as the public hospitals take on the burden of COVID-19.
When do you think that we'll hit that tipping point where we'll start to see public patients being treated in private hospitals?
In the coming weeks.
Is there anything you just suggested before you're expecting a wave of people in hospitals? What numbers are you expecting to see in hospitals over the coming weeks?
No, we're looking at modelling at the moment. I don't want to preempt the modelling. The numbers are rising substantially. The problem is this. It's a completely different pattern to what has been seen elsewhere. We've got a new virus, Omicron, and we're very dominant with Omicron here in Queensland, which has less severity. And we have a very highly vaccinated population. It is quite hard for our statisticians to give us accurate numbers. They are working on it, I know, and they have been all weekend to try and give us some idea of that, but I don't want to preempt that. We're assuming there will be substantial numbers in the wards and presumably in intensive care, even though this is nothing like the COVID-19 we saw prior to the vaccination program overseas and in Australia.
Do you think we'll have more super spreader events following New Year's and Christmas? Is that what you're expecting?
Almost certainly. This is a highly contagious virus, and we know it infects people who are vaccinated, particularly those who have received only 2 doses of the vaccine. The 3rd dose certainly appears to protect against getting infected even better than 2 doses. So for those people who are now eligible to receive the 3rd dose, please go and get it now. So that will be anyone who's more than 5 months since their last dose of vaccine, and in fact from the 4th of January it is, anyone who is 4 months from their last dose can receive the 3rd dose of vaccine, particularly those who are in the older age group, and I'm including anybody over the age of 50 should be getting that as soon as they're available. And if you're young, get it as well. Anybody who's eligible should get that 3rd dose. I certainly have.
Question for the Treasurer, if that's okay. Given there's been a policy shift in the last few days where the government's now encouraging people to start working from home again in January, has the government done any modelling on how that's going to affect businesses around the CBD?
No, not at all.
Are you concerned about it, given it's just started to, life started to return to the CBD and now we're encouraging workers to stay home again?
Well, our greatest concern is an accelerated or uncontrolled spread of the virus. That's the biggest single challenge for business. The reason that we've had one of the best economic responses in the nation, the reason that our budget deficit in Queensland is 1/10 of the budget deficits in New South Wales and Victoria, the reason we've been able to reduce debt and debt in New South Wales and Victoria has accelerated and almost exploded is because we've had a great health response. So I think businesses understand that. We're not planning to lock down, we're not planning to shut down, but we need to take care and caution, and they've been our watchwords through this entire period. So we'll take the health advice, as you've heard from the Chief Health Officer. 3 of the strongest things we can do are continue to get vaccinated, particularly boosters, wear masks, and of course, where possible, work from home. That's the way we slow the spread, which ultimately will be to the best, will be the best outcome for business industry.
And those businesses that rely on foot traffic from workers, how long should they expect that work from home advice?
Well, we'll continue to monitor that, and we'll continue to take advice from the Chief Health Officer. But what we do know is that the virus is coming to Queensland. It continues to spread. We're moving from pandemic to endemic. We have to manage that the best we can, so we will continue to take the health advice, which will be the way we can support businesses.
Or months should they be preparing for?
Big pardon?
Weeks or months should they be preparing
I will take the advice from the Chief Health Officer.
In terms of the next 12 months, how will the current health crisis affect the economy with more cases? Impact the economy in terms of more cases?
Well, we know that if we can manage the health response as effectively as we have previously, then we have a strong economic response, and that's been demonstrated in Queensland for almost 2 years now, and we've seen the economic benefit that has come to our state. 100,000 jobs created since the pandemic started. It's just in the last quarter that New South Wales and Victoria have got back into positive job creation. They just got back to recovering all of the jobs they lost when we created 100,000 on top of all of the jobs we've had. An unemployment rate the lowest in 13 years, lower deficits, lower debt, but obviously a strong economy, which is why we've set $2 billion aside in our mid-year budget update for COVID contingencies, because we had such a strong economic response and because our economy stayed open and kept operating. We could make provision for exactly this moment, continue to give us the fiscal headroom, the buffers we need, whether it's a cyclone, as we've heard. Thankfully it's a very moderate potential category 1, which may not have much impact, whether it's a cyclone, a bushfire, a flood, a drought, or the expansion of COVID-19, or another variant. We need to be prepared for that. So the stronger we can be in our health response, the stronger our economic response will be, and that will protect our economy.
Given we're getting closer to that 90%, when will the government be able to clarify the roadmap?
I'm happy to take that question and make sure you get a response from that, but we've got to get to 90%. That's the key point. We're doing everything we can. We don't know what the vaccination rate is from those vaccinations that are controlled by the federal government, particularly through GPs. Remember, this is not a state vaccination campaign, it is a national vaccination campaign, and we do our bit. Just as pathology, we have not stopped doing tests for COVID. The state pathology system has gone like steam through Christmas and New Year, but private pathology has closed. That's just the reality. Private pathology is not coming back online till about the 4th of January. We don't control that. We don't control or manage or direct private pathology. We can work closely, we can encourage them to open, which we have, but that's really the responsibility of the federal government. So we've done everything we can as a state, but we've got to get to 90%. We're sort of just over 86%. Double dose. We need to get that accelerated. As the Chief Health Officer said, that's likely to get to 90%, but we need to start accelerating that now, in my view, so we can get to 90%. Not so much because of border control, but because that keeps us safe. The higher our vaccination rate is, the safer we'll be as a state, the better it will be for our business and economy, and we need to continue to do that.
The target, the estimated time for that 90% was early January, mid-January. Now it's just not really saying when. Do you think it'll be by the end of January we'll hit that?
I can't tell you that. I'm not the leader in that space, so we'll take the advice from the Chief Health Officer. But again, getting vaccination rates up is important, and making sure as soon as possible people can get their second dose. The first dose, if they're not vaccinated, we've heard this morning about an unvaccinated pregnant woman in intensive care. That could be a very, very serious. We know from the experience in other parts of the country that could be a very, around the world, particularly in the United Kingdom, where very large numbers of pregnant women suffered severe complications from COVID. We need to ensure that we get people vaccinated. So whether it's first dose, second dose or booster, and on 4th of January we know that the window for booster shots opens even further. Again, a National Cabinet decision. That will be the way that we can keep ourselves protected.
And I'll take your sorry, you go.
Just out of interest, where's the Premier?
The Premier, we were on a teleconference this morning, and so she's leading the government, continuing to convene those teleconferences, but we're all doing our bit as members of the ministry to get the message out there to support the Queensland community and to support, from my position, the Queensland economy.
I just heard about the staff numbers in Queensland Health. What type of staff shortages are you expecting across the public service as these cases increase?
That I'm expecting?
Yes,
well, obviously, well, it's difficult to know because we have to see what happens with the spread of the virus.
What plans are in place to prepare for that?
Of course, we are ready to respond, and that means having staff working from home principally. If people work from home, we can continue to do that, then the number of people impacted by the virus will be less. A number of departments are already taking that action. We're taking action internally to ensure people are protected, and that's how we're going to keep people safe, and then we'll continue to operate through the pandemic as we have all the way through for the last 2 years. So service delivery will continue and the operations of government will continue. Okay, any more questions? Sorry? One more, last one for Dr. Girardi to go this morning. I think I need to let him get on with his work too.
Just following on from my question to the Treasurer about how long people should expect that working from home advice to be in play for. Is that weeks, months?
Well, the one, again, this is now getting into so the question pertained to how long the work from home period is likely to last. And I guess that depends on how long this wave of the vaccine will last. The one, and now we're getting into the realm of speculation. So the one good thing about a very contagious virus is that the length of the wave is likely to be shorter, in the order of weeks rather than months. Whether we then get another wave later on in the year, that's what we don't know. But it's likely in the order of weeks that the peak of this wave will last, rather than months, given the high degree of transmissibility of the virus.
The pregnant person that's in ICU, was that from Palm Island, do we know, or do we know what location they were from?
No, I don't think so. Not that I know of.
What's the vaccination rate for people in ICU? Just that one unvaccinated person?
I believe that's the one unvaccinated person. Just remembering, this is all about numbers. When you have such a high vaccination rate in the community, the probability that any one individual in the hospital has COVID-19 is vaccinated is high, even if when the vaccine is very protected. So it's all about numbers. So it's not surprising that a substantial number of people in hospital with COVID-19 are vaccinated. If they weren't vaccinated, then what we would be seeing would be much more like Italy or New York last year, and we're just not seeing anything like Italy or New York last year. It's not the same picture whatsoever.
Thank you. Thanks everyone.
Thank you.